Hello everyone, this is Dr. Hanna. I had a patient today who required a procedure where the meniscus was torn. The meniscus is essentially the shock absorber of the knee, and the way we perform this surgery nowadays is through a minimally invasive approach. We're using small cameras and small equipment to see the injured ligaments or areas of arthritis or just the surface anatomy in which the repairs need to be performed. What this eventually means is a quicker recovery time, much less pain, and return to your hobbies and work duties much sooner than previously when we were making bigger cuts. In a meniscus surgery like I have today in this patient, what we're doing is finding the tear and we're deciding if it requires repair or just clean out. Typically, most of these tears in the meniscus will be just cleaned or debrided back to sort of smooth lines. In this procedure, we went in, found the tear in the meniscus. It was a small tear, cleaned up the edges with our what we call shavers, and what this allows us to do is return the meniscus back to a somewhat normal anatomical structure. What this eventually does is help the patient in terms of their pain. It reduces clicking or popping sensations and just overall improves the patient's symptoms and function. The patient goes home typically with an ACE bandage and crutches for about 2 days full time, and then they're allowed to start putting their weight on the extremity that was operated on. It typically takes from the time of surgery about 4 or 5 days to sort of put full weight bearing on the knee and begin sort of ambulating that way. The discomfort is very minimal. It's somewhere along the lines of an ibuprofen or a Tylenol or an Aleve, something that's worked previously for minor discomforts for patients, and it's fairly well tolerated. I want to thank you for tuning in to listen to me today and hope to see you soon.